Hi, I'm MC Keegan-Ayer from the Frederick County Council of Frederick County, Maryland. I'd like to welcome you to the Maryland Association of Counties Conduit Street Podcast, featuring in-depth interviews and discussions with state and county leaders on the issues and policies that affect us all.
Hello, and welcome to the Conduit Street Podcast. This is Sarah Sample from the MACo Policy team, and I'm joined by my colleague, Karrington Anderson. Welcome, Karrington.
Thanks, Sarah. It's good to be here.
Right on. So today, we are going to dive into the opioid crisis and remediation efforts in Maryland. The challenges of this epidemic touch residents in a number of ways, and both state and local officials play a significant role in minimizing the incidence level of opioid use disorder among residents and the harm that it can cause to users, families, communities. It can run deep. So Karrington and I are both on this topic because it obviously has broad public implications in terms of health and human services, which is Karrington's portfolio, but it also touches on public safety and detention center issues. So it's certainly something we both have to keep a very close eye on. So on that note, we're very fortunate to be joined by the highest ranking official in Maryland that is specifically assigned to opioid and overdose remediation. So today we have with us Special Secretary Emily Keller. Secretary Keller heads up the Maryland Office of Overdose Response, so is working in this space every day with stakeholders and partners all across the state, probably in other states as well, I would imagine. So we are really feeling the privilege today and being able to discuss such an important issue with our state leader on the topic. So without further ado, welcome to the Conduit Street Podcast, Secretary Keller.
Thank you. Thank you guys so much for having me. Looking forward to this.
Absolutely. We appreciate it. So thanks for joining us today. But before we dive into all the moving pieces around sort of opioid remediation and some of the outcomes of the legislative session, tell us just a little bit about what brought you to this work and eventually leading the state agency.
Yeah, thank you. I think my story is a little bit unique in how I got here. If you would have asked me, 10, 12 years ago, if I would be in this line of work, if I ever would have run for office, I would have told you no. But my best friend from childhood actually was struggling with a substance use disorder for a lot of years back in, early 2010s, 2015. And I just really went through this process with her of trying to get treatment. She was incarcerated several times. And I watched what I felt like was our system fail her over and over again. And I just really wanted to help my best friend. And at the end of the day, I decided I could sit on the sidelines and continue to complain about things that I thought were not working as they should, or I could try to step up and do something about it. So I ran for local office in Hagerstown, became a council member in 2016. Unfortunately, in that same year, Ashley did lose her life to an overdose. And what was, by far the worst day of my life so far, I had to grieve, and then I had to remember the promises that I made her. And I promised her that I would be loud and bold and try to give a voice to the voiceless. So I felt really blessed. I got to join city council kind of in her honor, and I just went to work and became mayor of Hagerstown in 2020. And when Governor Moore was running for governor, when I would meet him in the capacity of being mayor, I would say, this is the number one issue facing the state of Maryland, because we can talk about taxes, we can talk about economic development, we can talk about a thriving state, but until we heal our people, we're not going to see Maryland be its best. And thankfully, he trusted me. He trusted that I was passionate enough about this subject, and he appointed me into this new position, the Special Secretary of Overdose Response. So I feel very grateful to be able to follow my passion and help people that I think just deserve it, because people who use drugs deserve dignity and respect and the opportunity to thrive just like everyone else.
Yeah, I mean, absolutely. And what I really appreciate about sort of your take on it is that when it came to sort of your early interactions with Governor Moore, it sounds like you were really clear and really aggressive on like what your perspectives were on this. And I think sometimes people like dance a little bit around, trying to figure out dance steps before like you'll be so clear about something. And I think that just is a testament to the kind of advocate that you are on something like this.
Thank you so much. It truly means a lot to me. And I joke often, I think he got tired of me like in his ear all the time. Like, this is so important. This is so important. But I really appreciate the opportunity and his heart and dedication, our Lieutenant Governor's heart and dedication to this.
That's really good. Thanks for sharing that, Secretary Keller. I kind of want to touch on some of the stuff that you and your office have done this year. The Office of Overdose Response, you guys have a new overdose response strategy, and it looks like it really lays out 5 pillars, 5 priorities there, and those are prevention, harm reduction, treatment, recovery, and public safety. From your perspective, which elements of this plan do you think have the potential to make the most immediate impact? And how are you working to ensure these interventions reach the communities that need them most?
We are very excited about the overdose response strategy. We know that overdose is a complex issue and it affects all aspects of someone's life. So the 5 pillars that we are focusing on across the continuum of care address all of those issues. We want to make sure we're addressing individual needs from all angles, including the 5 that you mentioned. This plan came about through collaboration with local partners and our local partners across the state and every jurisdiction. It's not just our office plan. It was compiled with input from state and local agencies, community-based organizations, the ones with boots on the ground who know their communities best. And we heard from community members, just everyday people who are seeing this in their lives that may not be directly impacted or directly involved, but also want to be part of the solution. So we need everyone working together. We're happy that everyone is working together. We know we need that to make progress. So we're working with our partners to support and track the implementation of the goals that are set forth. And we are actually currently compiling an implementation plan that'll have key performance metrics to help guide and track our progress, and also so the public can see where we're at.
That's great.
Yeah.
So I guess kind of on that, with those priorities, is there any that you all have identified or maybe heard feedback on that maybe one of them presents a greater implementation challenge, and any thoughts on how you all would overcome those?
I think stigma is still a very real issue in this field. We've come so far in the last 10 years, 5 years especially, and in understanding that substance use disorder affects everyone. I think addressing the social determinants of health and health disparities is very important. So there are angles like harm reduction can sometimes be controversial. There's a lot of stigma to it when you talk about syringe service programs, for example, but we know they work. So there may be pushback in certain areas, but I think it's all things that we can overcome as long as we continue focusing on the main message, which is saving people by any means necessary, and making sure we're using evidence-based practices, which we are.
Yeah, no, that's awesome. And I know your office has done a good job about building that trust with the communities too.
Yeah, the only thing I would add to that too is, was it last year or the year before, or maybe it was both of those years? I feel like you were doing a tour around the state and we're going to all the different jurisdictions and hosting these public meetings.
We did. We did all 24 jurisdictions. We had a town hall. So we spent at least a day in every county. I've been back to almost all of them since then. But that particular day that we organized, we'd meet with the health department, the hospitals, the treatment providers, police and fire, anyone who wanted to come to the table. And then that evening, we would have a town hall that was open to the public. We would normally have someone from the health department or someone from the county executive's office, myself, and then we would just open it up to the public to listen. And we learned a lot during that because we had the health professionals come, the clinicians, the doctors, but we also just had community members or families of loved ones who were struggling. So people who were using drugs themselves that wanted to voice what they thought could help them. It was really impactful. To hear from all parts of Maryland, because this is a state effort and we got to make sure everyone's voice is heard.
Yeah, and I think that was just very much a good example of making sure that it is a stakeholder collaboration that is very much like walking the walk in terms of that being a strategy.
Thank you very much. We wanted to make sure everyone was included.
Yeah. really just a thoughtful approach, and one that I'm sure other states can learn from. I know counties definitely appreciate that engagement as they play a huge role in this. And kind of going off of that, counties also play a really large role in deploying opioid settlement funds. And this year, MACo and our health officers, they supported a bill. It's House Bill 729. It helps modernize the opioid restitution fund. And I believe, correct me if I'm wrong, that you all supported that as well. So really kind of curious why you think it's important to update the law to reflect the National Settlement Agreement, and maybe how you think this change will enhance flexibility for local level and just maybe across the state.
Yes, this bill was something that we supported. The folks who sponsored the original ORF legislation did a really great job in identifying priorities, considering the fact that the national settlement documents, including Exhibit E, which outlines the allowable uses for the settlement funds, they weren't publicly available yet. So with that, over the last couple years, we've seen areas where our state statute and the Exhibit E were not aligned. So we were excited to see the amendments introduced by Delegate Rosenberg and Senator Ellis this year, which brings the state law in alignment with Exhibit E. It removes any confusion and unnecessary barriers in the administration of these funds. So you can look at one document and know, here's what the allowable uses are. And in the state of Maryland, we can use all of them. The funding streams, they're so complex. So
Yes, they are.
that increased flexibility, I think, will help state and local partners understand and how they can use the ORF funds.
Yeah, it just seems like a really common sense thing to do here. And I'm kind of curious too, kind of going on that, if this is going to enhance flexibility and maybe even innovation. Are there any creative or maybe unexpected ways you've seen counties use or maybe plan to use these funds? Or they can be other organizations as well that could be a model for other counties or even other states?
Yes, and we are getting a public-facing dashboard, which will allow people to see where the funds are being used. We're very excited about that because sharing best practices is going to be very important. Our office plans to do some webinars to share best practices, maybe host some municipalities and some counties who are doing it. We're seeing, I'll give you an example from our first round of grant funds, competitive grants that we put out. We had a couple organizations see the disparities, racial disparities and age disparities. So their grants were focused specifically on reaching 55 and older Black men in Baltimore City. And then we had a grantee that applied specifically for just aging population in general. So I think folks are listening and seeing where those disparities are and where we may be lacking some resources in this state and are filling those gaps, which is exactly what these funds are supposed to be used for.
Yeah. And yeah, thanks for mentioning that dashboard bill too. That was a bill that we ultimately ended up supporting as well. Worked with the sponsors just to get a few things that wanted to make sure that counties weren't doing copious reporting requirements, because they do a lot of reporting now and we want counties to be able to focus on remediation efforts. But yeah, really appreciate working with those sponsors and you all on that bill as well.
I was just going to say, I think it'll be a game changer. And there are smaller municipalities, especially, but counties as well, that don't live in the space every day, and they're doing a great job of reaching out to the health departments and the providers. But to be able to see what other counties are doing and compare and share notes,
right,
is a really great thing.
Yeah, absolutely. And I was just going to add that, I think the work that, both Karrington on our team and that your team did on those bills to sort of help make sure that the law reflects the settlement agreements, but also clarify some of the stuff is so important. Because when I was doing Health and Human Services before I handed it off to Karrington, I lived in those documents and spreadsheets from the AG's office, and they are so dense and there are so many of them and there's a lot of legal language. And I think the more we can streamline and clarify, the more that the resources can get to the ground urgently. And I think that is such a big and important thing with this, especially as there are potentially more settlements coming.
Oh, I absolutely agree. It is complicated. You're right. There's a lot of lawyer talk. So the more we can put it in plain language, the better.
Definitely.
Yeah, that actually is really good for what I'm kind of thinking where we should go next. And last time I really dug into the numbers on the opioid restitution fund and the state's balance, I believe was right before session. And I think that balance is around 75 million. At least it was in January of this year. I'm sure it's changed and you guys have probably distributed some more grants, but we know these dollars are crucial. They support life-saving programs. Counties, though, kind of what we're saying, this is can be pretty confusing. And I know that sometimes counties they're navigating a maze of funding streams. There's evolving reporting requirements. There's been a change in the agencies that we're supposed to reach out to access those funds. So I think it would be helpful, maybe if you could even walk us through how the current funding process works, including those different pots of monies and which agencies are involved.
Absolutely. There are two funding streams that represent about 30% of the funds that is at the state level. 70% of the funds do go directly to the participating local subdivisions, either as direct payments or as block grants. So 70% is going direct. 30% is at the state. 15% of that 30 we make available for grants. 15% of it can be used at the state's discretion. So there's a lot of numbers. Over 118 million in settlement funds have already been distributed at the local level, with another 18 million to be distributed to any subdivision that's not yet implemented a local abatement plan.
Yeah, and that was the thing that was tricky too. Another just sort of nuance in the legal settlements and the language between the agreements between federal stuff and the state, and then state and the locals, was that there was a distinction between like charter counties just had to open their account, and then there would be a transfer from the state, but then there were other non-charter counties that had to submit a plan, I think was beforehand. Yeah. But and then there was confusion about, I think, like the definition of charter county as we understand it in Maryland versus what it means in the settlement is different. So yeah, I remember that just being like, everyone worked really hard to try to like work through some of that confusion from the state and local level. And I was happy to be a part of that and happy we got through it because it was so important.
Yeah, we appreciate your help on that. And I think, speaking from my previous role as mayor, because the city of Hagerstown was one of the subdivisions that signed on to the lawsuit. So the money was coming direct to the city of Hagerstown, and there's pot of money coming direct to the county, Washington County. And that's similar all across the state. I think once the money came, a lot of the counties thought, well, I thought the money was going to the health department. And so, we've done a lot of work in explaining, well, you guys are the ones that sued, of course. So the money is coming to you, and then now we have to distribute that. So you're right. There was a transition period. It was some growing pains, but if we're continuing, we appreciate your help on spreading that message, especially to the counties and working through those logistics.
Yeah, and I can say even just from like a county to MACo perspective as sort of like their member organization is that like we took a lot of effort on our part to sort of make sure we got to every county and understand how they were organizing the funding locally, because in some jurisdictions it does go to the local health department and they have the discretion, and some it goes to the finance offices, and some it goes to the county executive's office. So it's trying to get all that information and then funnel it back to the state. Yeah, it was a whole lift because everyone's doing it a little bit differently. But the important thing about that is that they have the ability to speak to what their specific needs are locally, which I think is good. But yeah, definitely jumping through a lot of hoops to get as much clarification as possible was a bear.
Right. Because even some of the grants, some of those were competitive, some of those were non-competitive, and there was confusion of which of that was coming directly, what they had to apply for, what they didn't. It's been a long process, but
yes.
Yeah, and Secretary, your team at summer conference last year, I think it was, like your setup in terms like in our exhibit area and some of the feedback on the panels was really great about helping the locals clarify what they did need to apply for and what was competitive and what wasn't. And I think that was a big hurdle that I remember Teresa Heath on your team and some of the rest of the group really like did a big lift to try to clarify as much as possible. And we were so thankful to see that.
Thank you. Yes, we were very excited to prepare those documents, and we thought we have such a captive audience at that conference, so let's use it to our advantage. So we want to be a
Totally.
resource always.
Yeah, and on that note, sort of been working with Tracy. And is she a deputy secretary or is she executive director? I can never remember the title.
So she is our chief of staff and deputy director.
Got it. Okay.
Yes.
That makes sense. So then, and I was just plugging Teresa because she worked so closely and extensively with us this past year on some of the funding concerns that we were having locally with the medication assisted treatment in the detention centers. And so obviously, like a major touch point for treatment is harm reduction. And so those medication assisted treatment programs in all the local detention centers sort of help prevent dangerous withdrawals and an overdose when an individual returns to the community. And so these, and these, and this is more for our audience, these are programs they're required to be funded by the state. It's been a little bit of an inconsistent process and resource in terms of getting it on the ground to the local detention centers. And Secretary, you actually joined us in advocating for a bill this session. I believe it was House Bill 1084, Senate Bill 942 with Delegate Penny Melnick and Senator Sidner. And it was a bill that was trying to sort of stabilize that funding and make it less burdensome for local detention centers to receive. And we, MACo and GOCAP, the Governor's Office of Crime Prevention and Policy, they were big supporters of that as well. But unfortunately, like many bills, it didn't make it over the finish line. And so I guess would you mind sharing, with our audience a little bit about why that legislation was important for you and your team to be a part of in that stakeholder group?
Absolutely. This is such an important issue and one we've been working to address. It is so important, and you touched on this, but to provide substance use service in carceral settings is a game changer, and it's one of our priorities. This population is at greatest risk, and the 2 weeks after being released from incarceration is a time when someone is most likely to experience an overdose. So providing treatment services, but peer services and other supports like case management in these settings is essential. We're working to make progress. Another area that we did was with the Medicaid 1115 waiver, which now provides Maryland to provide coverage for people prior to release. Thank you to MDH for getting that done. And
Definitely.
We know the more we can do to support that population, the better. And that was the spirit of the mandate provided by House Bill 116 back in 2019. The state has made quite a bit of funding available to locals in the past few years, such as through grants through our office, MDH, and GOCAP. We've heard loud and clear that the processes have been difficult for the locals. So our goal is to make that process as easy as possible and to make sure people who need medications for opioid use disorder are able to access it. We definitely look forward to working with you in ongoing conversations on this bill. And again, there's been funds that have made available, but we don't want people to feel like they have to jump through hoops in order to receive it. So we want to streamline the process because there were several counties that didn't apply for some of the funding that was available.
Yeah.
That was like one of the biggest things that we heard.
Yeah. And it sort of like ran sort of the spectrum, because then you would have other counties where they would apply for 3 grants and, they would get denied one of them, but then they have the other 2, but then it's only sort of a portion or a fraction of what the actual cost of the program is. But then it would also, depending on what grant it was, it could be, you had to only be used in a very specific way. So yeah, it sort of like ran the spread in terms of like the difficulties that people were having locally. Yeah. And I think that your team definitely recognized that. And it was a big effort, but I think it was just one of those things that got lost in the shuffle. And we're also committed to working during the interim on sort of ways to make the funding process a little bit more streamlined and complete in terms of what the costs are. And I will say, like what you mentioned earlier on in this conversation is a little bit of stigma. And I think when House Bill 116 passed back in 2019, which was mandating the programs locally, there was still a little bit of that fear around bringing this kind of a medication into a detention center where previously it would be illegal. And there was definitely a learning curve there. And I think the education that the state has been able to do with locals, but then also some of the education the local health departments have been able to do with our local detention centers really helped bring people along in terms of trying to combat some of that stigma and understand that these are necessary services to save people's lives ultimately, especially when this is a situation where the death toll has been staggering over the years.
Yes. And thank you for bringing that up. I mean, it really is a learning curve. And we are asking law enforcement officers, we're asking correctional officers, to change the scope of what they're doing and how they have approached substance use disorder in general. And so that's a heavy lift and a heavy ask. And something I think Maryland is really leading the way on. I mean, we have made great strides and we still have a lot of work to do. And plan to continue to do just that. And we're thankful for the partners that we have and that continued education, because it's a heavy lift and a change to, a system that has done what it's done for a very long time. We're saying, hey, please switch all this up.
Yeah, exactly.
And it's for the greater good. And I think they see that now. Absolutely. Because we have incredible partners all over, but
yeah, and knowledge is power, and that helps us change our tactics and make our tactics more effective. And I think the detention center conversation is a good segue sort of into that broader conversation about public safety and the crisis. Public safety is one of the 5 pillars of your plan to address these challenges. So can you tell us a little bit about like what that component of the plan entails, and maybe a little bit about how local governments and our public safety officials can be more helpful, maybe successes we've had, maybe challenges we've had? Any thoughts on that?
Absolutely. Our public safety partners are so very important. And I say that knowing there's often a lot of distrust between people who use drugs and advocates and public safety officials. The decrim bill, that was a bill that was intended to address this. Participants in syringe service programs are still frequently arrested or cited for possession of paraphernalia, despite being protected by state law. In some cases, individuals who encounter law enforcement have to go to court to prove they're eligible syringe service recipients simply for possessing syringes, which places an enormous burden on individuals when they might be at their most vulnerable. So for too long, our society prioritized criminal penalties over access to care. And we've learned the hard way that approach doesn't always work, but caused immense harm in ways that were often disproportionately impacted to minority communities. With that said, we need our public safety partners at the table because they are often the first to encounter someone who's experiencing a behavioral health crisis or someone experiencing an overdose. And we have made a lot of progress in this area. And more than ever, people have alternatives to incarceration and unnecessary criminal penalties. One of our priorities and the state's priorities are programs like law enforcement assisted diversion, or LEAD. We know that's extremely helpful, and we love to see more of them. There's been a lot of talk. GoCap is doing a really great job of leading the charge there. And we are also excited to see more first responders start to administer buprenorphine after they encounter someone who's experiencing overdose. Frederick kind of piloted it and has had really great success. House Bill 1131 will help us better understand this landscape because it does convene a work group to study buprenorphine access in Maryland and identify how we can better support EMS that want to establish similar programs.
And so if I could just add something on that, we were in support of that bill as well. And I do think Frederick County really leads in this area. Something I love about the COAST program that they do is they include community paramedics, but they also include those peer recovery specialists who provide the medical. Yeah. So you have medical care and you have that emotional support. Just think, it's a great approach.
Absolutely. I have said this a million times, but I truly mean it. Peers are changing the face of this world of people who use drugs, the substance use disorder, just continuum of care in general. Peers, they walk the walk, they talk the talk, they make a connection that I can't make, that some doctors can't make, clinicians can't make. I mean, they are so thoughtful in their approach and so impactful. And it's great to see them partnering with law enforcement agencies and with EMS. And it's a real game changer.
Absolutely. Well, and one thing I wanted to sort of touch on before we wrap up today is I think it's good to talk about the things that are going well and the collaborations and things like that. But I also want to make sure that we're providing a space to have hard conversations and hear where it's not going well in the counties. And so I wanted to give you an opportunity to share. Are there challenges that you're running into or obstacles, barriers in some of the counties where you feel like, we could be doing more work as an association to sort of help bring people along?
That's a very good question. I think if we're talking opioid restitution funds, and we had this conversation earlier, just really having the counties understand what their role is, what we need from them, how they can put the money to use as quickly as possible, but also not recklessly,
Definitely. Yeah.
we want the money out the door, but we don't want them to spend it just because they feel like they have to spend it. And then I think anything we can do to eliminate stigma, this substance use disorder throughout history has been controversial in some areas. The written service programs are controversial. Harm reduction is controversial. Even carrying naloxone or Narcan was controversial when it first started. So just that education piece on how important these processes are and how we know we have evidence now. We can show you facts and statistics and things that work. And while you may have a certain opinion on how things have gone in the past or what can and cannot work, lean on the experts, listen to what's working, and focus on those areas. Again, politics are what they are. So
it.
yes. And sometimes people have learned things a certain way that may or may not be true. And so just making sure we can focus on the greater good, and that is helping people thrive, helping people, live the life that they want to live, and meeting people where they're at, and understanding that sometimes where we want someone to be is not where they are ready to be at that time.
Yeah.
And just get out of our own way with that.
Yeah, no, I hear that. And just like another point on the stigma, I remember kind of vividly when I learned this, but so it just really understanding how deep the stigma runs is that I'd heard in a few work groups that sometimes when individuals would present in emergency rooms and in hospital facilities, they were still running into sort of the conflict of stigma there, where they're being treated a certain way by the healthcare professionals in a hospital setting. And it was like, wow, that really runs deep if it's even coming from sometimes the healthcare professionals.
Yes. I mean, we've had to change the way that we've looked at this for so long. I think everyone really had a picture in their mind of what someone is experiencing or someone looks like who uses drugs. And if we've learned anything over the last several years is this issue knows no boundaries. It knows no neighborhood boundaries, no socioeconomic boundaries, nothing. It can happen to you. It can happen to me. It can happen to any of us. And we are starting to approach it like that. We still have a lot of work to do.
Yeah. Yeah. Well, I will say, I think we're very lucky to have you in the position that you're in the state, and we commend Governor Moore for recognizing that and putting you in the position to do this kind of work. And we're happy to be collaborators. So thank you so much for your time today.
Thank you so much. I appreciate it.
Yeah, Secretary Keller, thanks for taking the time to chat with us and our listeners, and congratulations on a successful legislative session and getting some of your priorities passed. We look forward to continuing to work with you, and we really do appreciate your time.
Absolutely. Thank you, guys. You guys are great partners, and we appreciate it.
Thank you. And just a quick reminder, our 2025 summer conference is coming up August 13th through the 16th of 2025. Our theme for this is funding the future, the evolving role of local government. This is going to be...
It's coming up so fast.
Yeah, so fast before you know it. It's going to be at the Convention Center in Ocean City, as it has always been. We're going to have some really great content and hope to see you there. Well, all right, that's it for us. If you enjoy hearing about local politics and policy, be sure to subscribe to the Conduit Street Podcast from whatever device and service platform you choose. You can always follow us on Twitter, Facebook, and the Conduit Street blog. On behalf of Special Secretary Keller and Sarah Sample, this is Karrington Anderson. Goodbye, and we will talk to you soon.